Morning, Mr. Jones. How are we doing today? My name's Drew Landau, and I'm gonna be your nurse today. I'm gonna go ahead and wash my hands. Now, can you verify your name and date of birth? That's correct. All right, now are you allergic to anything? Sweet. All right, I'll do a scan of the room. No hazards are noted. All right, so today I'm gonna be inserting an IV. So pretty much it's gonna be used to administer medication and fluids into your system the fastest way possible. So I'm gonna go ahead and check with your doctor, check the MAR to see if it's still ordered, and it is. Now, do you have any questions for me? All right, sweet. So I'll go ahead and put your arm to a good level. I'm gonna put this up a little bit, make sure that your arm is below your heart or the insertion site. I'm gonna check to see which side is. All right, so first I'll go ahead and prep this. I'll pull the pad. All right, so I'll scrub this for 30 seconds and let it dry for 30. And now we'll do the same with this. Scrub for 30, let it dry. Let's say 30 seconds have passed. Go ahead and screw it on. And then we'll take this off. All right, sweet. And I'll make sure there's no air in it. I gotta let the clamp go. Perfect. All right. I'll go ahead, put this on slightly. Go. And I'll put this into place so it's sterile. All right. Now let me go ahead and prep your arm. And slide this under here. Right, so you go ahead and squeeze your hand for me. Good, I'm just feeling your radial pulse to see if it's still there, and it is. I'm gonna check for a good site. Right here looks good. All right, and I'm gonna ask during this procedure, just make sure you keep your arm straight. All right. Go ahead and apply my gloves. Scrub the site for 30 seconds, back and forth motion. All right, let's say 30 seconds have passed. Put this back, let's go ahead and open this. All right, now I'm gonna go ahead and touch this. In the double OK method, take it off, set this aside. All right, now I'm gonna pull back 2 inches below the site. I'm gonna insert it bevel side up. Didn't go in. All right, we're just gonna pretend that it went in. So I'm gonna hold, pop the safety, rip this tourniquet out. Then we'll take this off while still occluding. Put it in. All right, now I can stop occluding. I'm gonna hold and assess for blood return. All right, I see it. I'm gonna flush, but since it's a mannequin, I'm not going to. Hold right here. Keep my window dressing. Right. Now I will grab my tape. Put in 3 points of contact. And unscrew this. Good. And I will clamp this shut. All right. Mr. Jones, how did that feel? Good. All right. I'm gonna go ahead and initial my date, time, and gauge. Date, time, and gauge, and my initials. All right. Now, feeling good? There are some things that I need to talk to you about, so I need to go over phlebitis and infiltration. So infiltration is where the vein gets inflamed and you might see a streak running up your arm. You're gonna have to let me know immediately that if you notice something like that. And also, if you see infiltration, that's going to be like you'll see it's kind of like when the medication isn't going in all the way, you might see the skin raised up, it'll hurt and it'll feel cold. So just let me know if you see that. I'm gonna go ahead and throw away my trash, put the needle and sharps container, discard everything I need or don't need. Right, and I will be back in 30 minutes to assess this, and I'll go ahead and document. I'll document the date, the time, the location, the gauge, how many attempts it took, and your reaction to it. So, all right. Do you need anything else from me, Mr. Jones? Perfect. All right, I'll see you later. I'm gonna wash my hands.
Okay.
Afternoon, Mr. Jones. How are we doing today? Good. My name is Drew Landau. I'll be your student nurse. I'm gonna wash my hands. All right. Can you please verify your name and date of birth? Sweet. All right. Do you have any allergies? No allergies. All right. I'm gonna check for hazards. All right. So today I'm gonna go ahead and remove the IV, but first I'm gonna check, make sure that's needed. All right. Your doctor wants me to remove it, so I'm gonna go ahead and take it out. Shouldn't be painful. Do you have any questions for me? Good. All right. And some gloves. All right. Get my Band-Aid ready. So, go ahead and hold this. This aside. Hold here. Pull out slowly. The bevel is intact. So I will hold this for 2 to 3 minutes. But if you are taking any blood thinners, then I will hold it for 5 to 10. If there's a hematoma check forming, then I will check and reposition, but there is none, so there's no need to. So let's say that Uh, 3 minutes have passed. Put this on. And I will pull over. There we go. All right, Mr. Jones, how'd that feel? Good. So, I just want to let you know, if you see any bruising, any bleeding, so if there's bruising, make sure you apply cold therapy. If there's bleeding, make sure to hold down on a little bit, and it should stop in a few minutes. So I'm gonna go ahead, clear all the trash out of your way, out of your space. All right, I'll wash my hands and I'll document the date, the time, the location, location. The bevel was intact, and yeah, I think that's good. So I'll wash my hands and I'll see you.